Coming out of the pandemic, there is a big push for vaccines. Not COVID-19 vaccines, but the common ones that most kids get before they're 2 years old. The WHO, the CDC, and other health leaders want to make sure kids get any vaccines that they missed over the last 3 years. I spoke with doctors at two major health organizations in San Diego to see how far we've fallen behind and what's being done to catch up. It's a Saturday at the Sharp Reese Staley building in Santee. And appointments are fully booked for a special pediatric vaccine clinic.
Okay, are you ready?
That's giving parents and their children a chance to catch up on shots at a day and time that works best for their schedule.
I think it's huge.
Nathan Frank is a pediatric patient care supervisor. He says this is just one way Sharp is trying to reverse 3 years of declining vaccine numbers because of the pandemic. Sharp recommends these 10 vaccines for kids by the time they're 2 years old. According to numbers they shared with ABC 10 News, the number of kids who got all 10 fell from 72.5% in 2020 to 67.3% in 2022.
Unfortunately, I think there are lots of families who have either had interruptions in their health care, perhaps even changes in their coverage. They're not sure where to get vaccines. There's misinformation online about vaccines.
Dr. Jershonda Hartsfield says the pandemic threw a lot of people's health care for a loop. Many parents were afraid to take their kids to the doctor because they didn't want to expose them to COVID. So they missed checkups, vaccines, and basic health care. To bring people back, Sharp is doing these special Saturday clinics 1 weekend per month.
It's never too late, right? We want to make sure that we get children in and get them protected from these vaccines.
Sharp isn't alone. According to UNICEF, 1 in 5 children around the world are under-vaccinated or not vaccinated at all. And during the pandemic, 67 million children missed at least one routine immunization. It erased nearly 15 years' worth of progress towards eradicating diseases and protecting kids. In California, CDC data shows the number of kids who got the 7 most common vaccines by the time they turned 2 dropped from an average of 72% in 2020 to 65% in 2021. By this point, basically everything kind of up to there, right?
Correct, yeah.
But some healthcare systems bucked the trend. I spoke with Dr. Eric Hogan, the chair of Scripps Health Pediatrics. He says among their 5 San Diego clinics, 3 have better 2-year-old vaccination numbers so far in 2023 compared to 2019. One dropped by 1.5%, another is down 11.4%.
In some sense, we were able to maintain it just based on a lot of effort.
Dr. Hogan says his team scoured medical records to find patients who missed well checks or vaccines and called them to set up an appointment.
Yes, it's as simple as that.
It's a strategy Sharp is also doing now, along with outreach to let people know if their kids missed a shot, that's okay. They can pick up right where they left off.
Don't let your child be one of the statistics that becomes susceptible to these illnesses. Bring them in, get them their vaccine.
I think the message is just we have to keep going. We have to keep preventing those illnesses because, I mean, it's the lives of our children.
The doctors I spoke with say education and access are still the main barriers to getting every kid the vaccines they need. And they stress these vaccines have been around for decades. They are safe and they're effective.